Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Hot flashes, fatigue, weak bones. These are usually symptoms associated with menopause in women. But as men age, their testosterone levels go down and they can experience these same symptoms. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Sarah Medley. Today we talk about why low testosterone should be a high priority for men's health. Stay tuned. Welcome back. Joining us today is Dr. Roman Hendrickson, board certified in family medicine and geriatrics, who is here to talk with us about testosterone and the important role it plays in men's health. Welcome, Dr. Hendrickson.
Thank you.
So, question for you. I think a lot of people understand that testosterone is a hormone in men, but can you explain it a bit further? Talk about what it does.
Well, it's known as the male hormone because men make more of it than women do. It's associated, of course, with sex drive in men, but also capability to be able to have sex. It also affects bone and muscle mass, affects red blood cells, endurance, and a variety of other things, including mood.
So testosterone levels go up with puberty, and then they go down. When does that start?
Sort of peaks out around 30, and then it starts going down about 1% per year. Other things can affect the levels of testosterone as well.
So what are some of those things that cause decreases in the testosterone level?
Decreases in testosterone can occur due to injury to the testicles, changes in the pituitary gland, which is located into the skull and the brain, cancer treatments, chemotherapy, certain medications such as hormones that are used to treat prostate cancer, chronic diseases such as kidney disease, liver disease, alcoholism, certain medications, smoking can have a negative effect on testosterone, obesity, and even stress.
So when we talk about those testosterone levels being low, what does that mean?
Well, we can measure the testosterone level, and they usually run somewhere between 250 to about 1100. Men with testosterone levels somewhere in the range below 300, give or take, may experience the effect of low testosterone, or some people call it low T, just to not pronounce the long word.
So what are those symptoms of low T as you describe it?
I think the first thing that most people would recognize is the loss of sex drive, so lack of desire for sex. But along with that is loss of ability for men to get an erection or sustain an erection. So if you can't get an erection and there is no desire for sex, then you have to question whether there's a possibility of low testosterone. Other things that can occur are mood disorders, such as depression. It can affect memory, so that there's depression, difficulty recalling things, hair loss can occur, fatigue and loss of endurance. So people just kind of poop out a little quicker than they normally would. Loss of muscle mass, some decreased bone density, so the bones are not as strong as they were. People can get fractures easier. Weight gain, the distribution of fat changes, especially men may notice that their abdomen gets bigger disproportionately to their arms and legs. They lose the muscle mass in their arms and their legs, and their belly gets bigger. That can be associated with low testosterone. Also, hot flashes. Men who have low testosterone, just like women with low estrogen, can get hot flashes and sweating.
So what are the implications of those symptoms? Is low testosterone dangerous?
Well, you can have decreased bone mass, which would allow a man to have fractures easier. You can lose muscle mass, which makes you have less strength and ability to do normal tasks. Weight gain obviously is not a good thing, but the type of weight gain that can occur with low testosterone can be what we call visceral fat, which is the deep fat that can form around the organs in the belly. Diabetes can occur more commonly in men who have low testosterone.
So when should a man see his physician?
I think the more symptoms that a man has that fall into this category, the more concerned they should be that this is a possibility, especially lack of sexual desire, lack of ability to maintain an erection. Then when you add that to the constellation of difficulty with energy levels, maybe more depression, weight gain, those things all point in that direction, and at least they should have the testosterone level checked.
So what does a doctor do to find out if those symptoms are really symptoms of low testosterone levels?
I think the main thing is to just get the level checked first, and then if the level is low, a lot of it can be followed, and you treat the low testosterone. You may have to treat some of those symptoms independently, or you can watch and see how many of those symptoms improve once the testosterone levels are improved. Of course, if you're overweight and they're caused by low testosterone, if you don't work on the weight loss and improve the testosterone, you can't solve that problem because one makes the other worse.
So in the few seconds that we have left, sometimes a man might be a little embarrassed to talk to his physician about an issue like low testosterone. Can you give men in the audience some advice?
I would say if you talk to your physician and say you're concerned about your sex life, that this may be something as a lead-in to talk about the testosterone.
Very good. Thank you for the information. Well, we need to take a break, but coming up next, if your symptoms are caused by low testosterone, what are your options? And what are the risks and benefits of different treatments? We have a lot more to talk about. Don't go away. Welcome back. A common treatment for low testosterone is testosterone replacement therapy. Dr. Hendrickson is still with us to talk about the risks and benefits of this treatment option. Thanks for staying with us, Doctor.
You're welcome.
So, if tests determine someone has low T, one treatment option is testosterone replacement therapy. But what does that entail?
Well, lately, because it's becoming more of an issue and there's more demand for replacement, pharmaceutical companies have come up with a variety of ways to obtain the testosterone in your system. They've got skin patches, which can be applied once a day. They've got gel that comes in packets and pumps, and those come on once a day. Mouth patches, injections, implants. So there's a variety of ways that this can be applied. The one that's been out the longest is the injections, and that can be done even by someone in your home about once every 2 weeks on average. The other ones are usually once a day.
So there isn't just a simple pill you can take?
Well, there are pills, but most people have shied away from those. There's some evidence that that may be harmful, some concern it may actually cause cancers and other liver problems because the way it's absorbed goes directly into the bloodstream and is metabolized through the liver as opposed to the other ones that go through the skin or get absorbed into the system in a different fashion. So we try and avoid the pills.
So I want to talk about some of the possible negative effects of replacement therapy, but let's first talk about the benefits. So what are a few benefits?
Well, I think besides noticing that the sex drive improves and the ability to get an erection can improve and usually does shortly after beginning, men will notice that their energy and enthusiasm in general can improve. Bone density takes a lot longer to develop where the bones become thicker. Muscle mass can change, especially if they're working with resistive exercises such as weights. If you don't exercise, you don't notice the muscle mass as much. Weight loss can occur if you work on losing the weight. You can't just take the testosterone and expect the weight to come off. And mood improvements can also occur. So a lot of times we'll have men who are significantly depressed, we're having trouble getting that better, check their testosterone level, find it's low, start them on testosterone, and it helps in the treatment of their depression.
So those are the benefits. Now let's talk about some of the risks. So what are some of those risks?
Well, if you're applying the patches or the gels, etc., you can get rashes and itching and irritation. The testosterone itself can actually cause acne-type breakouts in men because it mimics kind of the effects of what happens at puberty in men when they get acne. It can enlarge the prostate, so you can have more difficulty with urination. If they're not sure that it causes prostate cancer, but if you have an early prostate cancer, there's a belief that the testosterone can make the prostate cancer really take off and grow much quicker. If someone has sleep apnea and it's not being treated, it can make the sleep apnea worse. Because it affects the red blood cells and the blood system, it can make people more susceptible to forming blood clots. And because testosterone can be metabolized into estrogen, if you get too much testosterone, or in some men who are sensitive to it, it can be cause men to get enlarged breasts, but that's a very small number.
So what about heart attacks and strokes? Can you speak to those risks?
That is a concern, and we watch for those, and we try and explain that to people that there's a risk. We know that men are at more risk for those than women, and obviously that's related to the male hormones to a certain extent. It's hard to quantify how much that increase risks. To a certain extent, that's one reason why some physicians are a little bit reluctant to prescribe testosterone to men. They feel that the risks may exceed the benefits.
So with all those risks, and it does sound like there are a few of them for sure, how does a man know that he's a good candidate for this replacement therapy?
I think they need to talk it over with their physician, and the physician can share their recommendations based on the individual's risks versus potential benefits. People who have certain risks probably should not take testosterone. But I think that's so individual, it should be discussed with their individual physician.
So if someone decides to go for the replacement therapy, is this something that they have to do the rest of their life?
Yes. If you're going to take it, you probably need to take it ongoing forever, because the reason you started in the first place is because your body was not making enough, and your body will not start making enough at some point in time down the road. You're supplementing what your body doesn't make enough of.
So overall, what is your professional opinion about replacement therapy, and would you encourage it for appropriate patients?
Overall, I feel that for a significant number of men, replacement therapy is worth a try. Because injections are not acceptable to a lot of men, they choose not to use the injections, and the cost of the other modes of testosterone is high. That a lot of times will keep people from using it. Other people get side effects, they choose not to use it. But I think the benefits for a large population far exceed the risks.
Thank you so much. We need to take another break, but coming up, are there natural ways to boost your testosterone levels? We'll find out right after this. Don't go away. Welcome back. Some lifestyle changes that are good for your overall health could also help with a healthy level of testosterone. Dr. Hendrickson is still here with us. So are there natural ways to maintain or even increase testosterone levels?
Yes, what we find is that men who exercise regularly and maintain their body weight as close to ideal as possible tend to have less problems with their testosterone. If people are overweight or exercise less, it has been shown that you can improve your testosterone levels if you improve your exercise and lose weight. Fat cells tend to interfere with testosterone production and convert a lot of it to estrogen. Dietary changes can improve things as well, so you are what you eat, so to speak. Healthy things in your diet, vitamin D, zinc, lean proteins, and healthy fats such as fish and nuts tend to help as well.
So stress can actually lower testosterone. So does avoiding stress raise it?
Avoiding stress can improve things, yes, because stress through a variety of mechanisms can affect the body's production of testosterone. Hard to avoid stress, but where possible, stress can be related to even your sleep, how much time you spend at work, how much stressful situations you're involved with, and try and increase the things you enjoy.
So actually getting more sleep can help raise testosterone levels.
Yes, generally if you can get between 7 and 10 hours of sleep, 8 is sort of the ideal. That tends to optimize the testosterone levels.
So are there medications or drugs that can impact testosterone levels?
Certain drugs tend to be more problematic than others. The pain medications, the opioids that we've heard so much about lately for other reasons, are probably one of the biggest prescription items. But glucocorticoid drugs such as prednisone and related drugs tend to also be another issue that we have to deal with.
So what about testosterone supplements or vitamins? Is that something that you would recommend?
There's actually no good studies that have shown that any of these things that are non-prescription have any additional benefit. We did talk about vitamin D and zinc, so obviously if you're supplementing those, that will help a little bit, the proteins, but not to the exclusion of the healthier lifestyle.
So we haven't really talked about low testosterone levels in women, yet women have testosterone. So can you talk about women and can they experience low T?
Yes, women make testosterone as well, and testosterone in women is responsible for sex drive in women as well. So women who have low testosterone will tend to have less sexual desire. Increasing testosterone in women can improve their desire for sex. It can have other positive effects if it is brought into proper range, but too much testosterone in women can also have adverse effects.
So can you talk about some of those adverse effects? So if my testosterone level were too high, talk to me about that.
So in women who have got excess testosterone, they've supplemented with too much testosterone, they tend to have irregular or absent periods, they may have more body hair, they may sometimes lose hair on their scalp, become balding or thinning hair, and it can cause infertility, and it may be difficult for them to become pregnant.
So we talked about diet, and you mentioned a few foods that might help. But can you talk a bit more about some foods that you might suggest helping to increase those testosterone levels?
So the nuts, fish, those are the primarily ones, the vitamin D, some of the green leafy vegetables, basically the things that you would consider in a healthy diet.
Okay. So women who have low testosterone, we touched on that a bit. Can you talk more about some of the other symptoms that women might experience?
Well, testosterone is responsible, it's what we call an anabolic steroid. So it helps build your body up. Just in men, as in men, it can affect your muscle mass and your bones. In women who become more frail, giving them additional testosterone can help build their body up. It can also improve the character of the vagina and the tissues in the genital tract. So if we have women who are having problems with atrophic or breakdown of the tissues in various places, small amounts, but more than what they're currently taking, may increase their ability to build their system up in various areas.
So if men or women are concerned about their testosterone level, what are a few things they could do, say tomorrow or next week?
Well, I think the first thing is to, talk to your physician about your concerns and make some notes before you go into the doctor about what your concerns are. It's always helpful when someone comes up to me and says, here's a list of the things that I'm concerned about. The more information I have, the more likely I am to be able to give them a straight answer. If there's things that all fit together and make it look like testosterone may be a concern, we can always order the blood test. And if the blood test goes along with the symptoms that someone is having, then it will make more sense for us to treat them. If someone just has a blood test and we don't have a set of problems that we're trying to address, I'm less likely to want to give them the testosterone.
Great. Thank you so much for joining us. I know I learned so much. I appreciate you being our guest. That's all the time we have. We hope you'll come back next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.